Back. We're tracking the latest on COVID-19 as Merck becomes the latest drug maker to have its COVID-19 pill cleared by the Food and Drug Administration. The FDA authorized Merck's treatment earlier today, but said it should not be the preferred treatment given it is only modestly effective while also carrying the possible risk of reproductive harm. Pfizer's oral COVID-19 pill was also authorized by the FDA earlier this week. For more, we're welcoming in Dr. David Katz, Preventive Medicine Specialist and Truth Health Initiative President. Dr. Katz, thank you so much for joining us this afternoon. I first want to get your take on these COVID-19 antiviral pills just now getting authorized by the FDA. How much are these going to relieve the hospital systems now filling up once again with patients with COVID-19?
Well, good to be with you, Emily. And the answer to your question depends on how effectively the drugs are used. We had an opportunity, for example, to reduce hospitalization and mortality from the pandemic much more than we did with vaccines if they had been used more effectively. If more people had been vaccinated promptly, we actually might not be in the Omicron mess at all. So the same really pertains to the drugs. These drugs are effective at stopping viral replication. So they're most effective after you've been exposed, test positive, or have early symptoms, but before you get really sick. So there's a window of opportunity, generally the first 5 days of infection. So we need the drug widely dispersed around the country. We need people who have symptoms to get tested, find out whether or not they've got COVID. We need docs making effective and prompt use of the drug. So if the drug gets to the people who need it, it can make a huge difference. It can reduce hospitalization by 70%. So in that group that's prone to severe infection with Omicron, which would either be people who are unvaccinated or people who are elderly with chronic disease who are prone to hospitalization for other reasons, and this basically just tips them over, effective prompt use of these drugs can make a huge difference. So I'm hoping that's what happens.
Doctor, this is a question kind of everyone getting ready, or not everyone, but a lot of people traveling today, tomorrow, Christmas, the holidays. And it's based on a conversation I overheard in my building. If someone was in a gathering where someone 5 days later has tested positive, what's when you're exposed to somebody, how long before symptoms would show up? How long should you quarantine if you've been exposed but have no symptoms? All of those questions.
Great question, Adam. And actually, I've seen evolving recommendations that the period of recommended isolation should be reduced down to about 5 days, because the high infectivity of both Delta and now in particular Omicron means if you get exposed, you're going to get sick within a few days of that. And also the infection runs its course a lot faster, especially in people who have at least partial immunity, but in general. So 5 days of isolation. To be honest, I'm going to sound more radical than I want to be, Adam. Very centrist and moderate about all of this, but I really don't think testing of asymptomatic people is going to be terribly helpful in the Omicron phase of the pandemic. This version of the bug spreads so well. By the time you test positive, you've exposed everybody that you're worried about exposing already. I don't think we can contain this bug in terms of its general spread. What we can do is massively reduce the impact of that with immunity, and that's vaccinations and boosters or vaccinations and prior infection. And then we can, as we were just discussing, promptly make good use of these newly available drugs so people at high risk of severe infection don't develop severe infection. And that requires vigilance for people who have symptoms. Mostly the drugs used is after initial symptoms develop. Then you quickly use these drugs. You terminate the infection before it becomes severe. So isolation after exposure to somebody, I don't really think that. I think we're fussing about the barn door after the horses are out. That's just my perspective. But the answer to your question is official policy is still recommending longer periods of isolation, up to 10 days. It looks like 5 would be ample.
Dr. Katz, in that same vein, then, as we think about vaccine mandates and requirements, vaccine passports going forward, are these really going to be necessary if for now it seems like both the unvaccinated and the vaccinated are testing positive with Omicron?
Another very good question, Emily. Does it make sense to worry about vaccinating people after they've had the infection? One of the things that has not received nearly enough attention at any phase of the pandemic is the immunity conferred by natural infection, because you're at least deriving partial immunity to all of the related strains. And if you had the infection at any point, the original or Delta, and get vaccinated, that vaccine effectively is a booster. So do we worry about additional vaccines? Do we worry about boosters in that population? I really do think in a population where millions and millions of people have had the infection, public policy should be talking about two groups, those who've had it, those who haven't, and what the recommendations are there. I really don't know what the value of pushing vaccines will be after Omicron, but we don't know for sure that this is done. And it's pretty clear that the mRNA vaccines, Pfizer and Moderna, have been quite effective, not perfectly effective, but quite effective against all the strains. So if Omicron isn't the last we hear from SARS-CoV-2 before this is well and truly behind us, there may yet be value of vaccination. But at this point, I'm not sure new vaccine mandates can catch up with the rapid dissemination of Omicron. This bug is really good at spreading. Good news, however, we now have evidence both from South Africa and the UK that the disease imposed by the Omicron variant is decisively less severe. And so really the risk for severe disease is isolated to people with chronic illness, advanced age, the combination of the two, people who were prone to get very sick with very mild infections before Omicron came along.
Is that the silver lining to this cloud, that Omicron, it's almost as if we should all be expecting at some point we're going to get it, and hopefully we're all vaccinated. But after that, we can just get back to where we were, 2 years ago?
Absolutely, yes. And Adam, I know you've got to get back to business literally here at Yahoo News, so we don't have time to talk about all the nuance. But one of the ways pandemics end is significant mutation in the virus. And let's be clear, it takes a lot for a virus to be just right, to be as bad as this one has been. When that virus changes substantially, there's a pretty good chance it's going to be less effective at being a perfect pandemic virus. It looks like Omicron may be our friend in that regard. Significant mutations, different enough from the parent that it doesn't make people nearly as sick. And it spreads better, so it starts to displace the parent version from the population. So we do have to guard against those cases where it can be severe, people who had chronic respiratory disease to begin with. Hospitals tend to fill up this time of year in general without a pandemic, because cold weather makes people with heart disease and lung disease more prone to severe illness. This isn't going to help in that regard. But yes, I do think the silver lining is it spreads really well, it displaces the former variants, and it makes people less sick in general, which means one way or another, the healthy population that's out and about, probably all going to wind up getting this. It's mostly going to feel like a cold, and it will confer at least partial immunity against whatever strain follows. And it will be one of the things that helps us put this pandemic behind us.
Dr. David Katz, preventive medicine specialist and True Health Initiative president, thank you so much for your insight this afternoon.